with Valentine's Day coming up, you'll want to make sure that your partner is happy. Here with some snoring solutions is Dr. Harvey Schiffman. Doctor, good morning. Thank you for joining us today. Boy, what a timely topic. I mean, I guess it always is. This affects so many families. So just how many of us snore?
Well, probably in the U.S., anywhere from between 60 and 80% of people snore. And out of that percentage, about 60% have some type of sleep disorder, like sleep apnea.
Does it get worse with age?
It does get worse with age because the tissues in the back of the throat tend to lose their elasticity and kind of fall down to block the airway.
That's what causes it?
That's part of it,
I mean, when you're a kid and you're snoring, it's because maybe a deviated septum or you have a cold or something like that?
Or tonsils and adenoids, that type of thing.
All right. Can it lead to health problems?
It can. Untreated sleep apnea can lead to high blood pressure, diabetes, increased incidence of stroke, hormone dysfunctions, and many other things.
All right. You mentioned the loose skin or the loss of elasticity back there in your throat. Is that the primary reason why we snore?
For most people, yes. There's a small component of people that do have, nose problems, nasal blockages, that type of thing, deviated septum, like you mentioned. But the biggest issue is in the back of the throat.
More men than women?
No.
No?
Okay. Women tend to admit it quicker than men do.
Weight? Does the weight?
Weight definitely contributes.
Drinking, smoking?
That all contributes,
really? Okay. Skinny people, do they snore?
Some skinny people do snore.
Really? Okay.
Yes,
all right. Well, I think I'm done with questions, but you brought something here. This is the CPAP?
The traditional treatment for sleep apnea and some snoring is the CPAP machine. The mask gets hooked up to a little pump. There are also oral appliances that go in your mouth. All right, that pull the lower jaw forward. The treatment that we've been using for most of our patients is the NightLase treatment.
The what?
The NightLase treatment.
Okay.
We use a laser called a Fotona Lightwalker laser, and
so you can see it.
We're actually stimulating the tissues in the back of the throat, forming new collagen and tightening up the existing collagen that's there. So the soft palate, the uvula, which is the tissue that hangs down in the back of the throat, actually lifts up and opens the airway. And the patients benefit from that 24 hours a day. It's not uncomfortable. It feels like you're sipping warm towards hot coffee, and then as soon as the treatment is over, it's done. It
tightens that area back there.
It tightens that tissue. We actually
you said that's the primary reason that people snore.
The treatment is therapeutic. It lasts for about a year or more for the patients, and they'll have to have a touch-up done about once a year just to keep it up to
And the CPAP costs?
CPAP costs are thousands of dollars. Obviously, they have to wear the mask and the hose, and there's a machine that hums all night long. And not the most comfortable thing for people.
We're getting there in terms of a solution. That sounds promising.
Yes.
Now, if you could just get insurance to cover it.
We're working on it. We're working on it. But we've had amazing results with it, about 80% positive results with our patients. And the NightLase is definitely a good alternative.
All right, leave me your card.
Okay.
That way my wife will be happy. All right, and I'm sure that a lot of happy wives out there are learning this, and happy husbands as well, right?
True, very true.
Thank you so much, Dr. Schiffman. Let's send it back to Roxanne.
I'm all ears on that, too.